Why did you go into primary care? Maybe you wanted to form lasting, healing relationships with your patients. Maybe you wanted to provide comprehensive, whole-person care and manage the health of a population. Maybe you believe that primary care should be the backbone of our healthcare system. Delivering patient-centered, comprehensive primary care is hard work, but you and your care team are ready to enhance the care you deliver for all of your patients, particularly those with complex needs. Comprehensive Primary Care Plus, or CPC Plus for short, brings together payers and clinicians to change the way primary care practices have been doing business for decades. Primary care clinicians want to provide the best care possible for their patients. They want to ensure patients have access to care and build long-term relationships. They want to more closely manage the health of their high-risk patients. They want to provide comprehensive services to their patients within their practice and be able to connect patients to high-value providers outside their practice. They want to engage patients and their caregivers to be active not only in their own health, but also in the improvement of the practice itself. And they want to have data that drives their quality improvement efforts and informs how to best care for their patient population. These changes won't be easy and will take time. They may even require a fundamental cultural shift. But we're at a turning point. CPC Plus provides the tools, financial supports, and guidance for practices to spend more time with patients to deliver the best care possible and improve the healthcare system. In CPC Plus, we're moving one step closer to placing patient relationships at the center of what primary care clinicians do every day. So, what will this look like on the ground at your practice? It depends. CPC Plus is organized into 2 tracks based on practice capabilities and readiness to jump into the work. And the way you implement CPC Plus will reflect your specific patient population and organizational structure. In the first year of CPC Plus, Track 1 practices enhance important areas of their work. They'll develop the foundation for team-based care by empaneling their entire population of patients and ensuring that patients have 24/7 access to care informed by the electronic health record. Track 1 practices will also segment and stratify that patient population according to patient risk, develop the capability to provide proactive, relationship-based care management to those at highest risk. These practices will use payer data to understand where their patients are receiving care and to focus coordination efforts on hospital transitions and high-volume specialists. Practices will work to engage patients and families through patient and family advisory councils in the design of care that best meets their needs. Finally, Track 1 practices will review utilization data provided by payers to guide practice change. Track 2 practices will strengthen all of the capabilities mentioned for Track 1 while they also advance further. They will deepen their patients' access to primary care by expanding the opportunities for care outside of the traditional office visit. Track 2 practices will refine their risk stratification process and use care plans for these patients to assure the provision of care consistent with the patient's goals and wishes. They will increase their ability to coordinate the care of their population by enacting collaborative agreements with specialists. To address their patients' psychosocial needs, practices will begin to integrate behavioral health care into their practice and inventory community and social supports. Track 2 practices will empower their patients to manage their chronic conditions successfully by developing practice capability for support of self-management. Practices will leverage the whole care team to develop quality improvement strategies that use cost and utilization data. And that's just the beginning. As practices become familiar with the initial stages of delivering comprehensive primary care and gain expertise, they will be ready to refine their work and will see opportunities to continue to improve their patients' health outcomes. In CPC Plus, you will work to transform your delivery of primary care so that you can improve the health of patients and their experience and quality of care and reduce unnecessary healthcare utilization. In the process, you may find that you are fulfilling your passion for delivering primary care that led you to go into the field in the first place.